After a few rapid attempts at correcting the situation with minimally invasive techniques, Chris Feindel was forced to perform a heroic open operation that involved repair of the aortic arch and aortic valve replacement in an extremely unstable patient. 3 days later, this amazing 76-year-old woman was recovering and walking in the intensive care unit, apparently doing very well, but then tragically suffered a sudden, fatal gastrointestinal hemorrhage. Some stories like Linda's unfortunately have tragic endings, but nevertheless demonstrate our need to innovate technologically when our conventional management is either ineffective or too dangerous. We must learn from our successes, and sometimes we learn even more from our failures. In fact, the cardiac team has carried out 4 such procedures since, and these patients have recovered and are all at home.
Beautiful laugh.
Thank you.
Would you like to learn to tango, Donna?
Right now?
I'm offering you my services, free of charge. What do you say?
I think I'd be a little afraid.
Of what?
Afraid of making a mistake.
No mistakes in the tango, Donna. Not like life. Simple. That's what makes the tango so great. If you make a mistake, you get all tangled up. Just tango on. Why don't you try it? You try it?
All right, I'll give it a try.
Hold me down, son.
I love that movie. Yen is a 21-year-old mother of 3 small children. She was living the normal, happy, busy life of a young homemaker until she became gradually more short of breath and was diagnosed as having advanced pulmonary hypertension. She progressed to the point that she had significant congestive heart failure as well, was admitted to the ICU to be given maximal medical support, and was waitlisted for a lung transplant. Increasing pulmonary failure led to intubation, ventilation, and the decision that lung transplant was critical to save this young woman's life. For the first time in North America, the Novalung device seen here, previously introduced in Germany, was used to offer her temporary respiratory support while a donor lung would hopefully become available. Although the Novalung is a membrane ventilator usually employed in a situation when the patient's own heart continues to pump adequately, Yen's heart failed so badly that a circulating pump had to be added to support her circulation. During this procedure, she suffered cardiorespiratory arrest, was resuscitated, and an urgent call of the highest priority was placed for a donor organ. Luckily, a heart and lung became available, and Yen underwent a successful heart-lung transplant on December 2nd of last year. Here's Yen and her family a little over 2 months later at a press conference. She continues to be well and is back to the easy life of homemaker and mother of 3 small children. This story is a North American first with a wonderful outcome and represents technological innovation, to be sure. And like much of our creative work here at UHN, it emphasizes the fact that these new trails are being blazed at the same time that this thoracic team continues to treat all their patients with more common problems, educates students at every level, and engages in groundbreaking research in lung cancer, pulmonary failure, lung transplantation, mediastinal tumors, and so on. In other words, all those involved in these inspiring stories have a number of day jobs as well. Jean Nisbet is a registered nurse working on the orthopedic service at the Toronto Western Hospital here, a floor that has been engaged in a novel 80-20 program whereby nurses spend 80% of their time in conventional patient care duties and the other 20% on academic or other pursuits aimed at personal growth. Jean enrolled in a 19-month accelerated program at Ryerson University to upgrade her diploma to a BSc nursing status as part of the 80-20 program. She was promoted to patient care coordinator shortly after completing her degree and was mentored by manager Olga Muir, whom Bob referred to a little while ago. Then further new managers and payroll training prepared her for an interim manager position in December 2006 to mid-February of this year, a time in which she apparently performed admirably according to her peers, staff, and senior administrators. Olga's team members have benefited tremendously from this 80-20 initiative, an innovative approach to nursing, to succession, and to leadership, another example of why UHN has won the Top 100 Employer Award in Canada 4 years running. And there was a case of Diana, a delightful 45-year-old woman, homemaker, mother of 3 small children, and wife of a prominent Toronto lawyer. Like too many young women, Diana developed an ovarian carcinoma about 5 years ago and had an initial encouraging response to Joan Murphy's surgery and subsequent chemotherapy. She continued on with her hectic life, caring for her family, her home, and a third passion, a thoroughbred named Phelan. After getting her children off to school, she would travel almost daily to see her horse, to groom him, and to practice for the frequent dressage competitions she entered, and often won. Unfortunately, 2 years after remission, or after 2 years of a remission, Diana's malignancy returned. And as so often happens, each recurrence became progressively more refractory to treatment. The situation reached a point that a long hospital stay ensued with palliation as the only reasonable objective of medical care. Diana and her family prepared themselves as well as any could under horrible circumstances, but something was missing. She had not seen Phelan in many weeks, a friend who had really been a member of her family for such a long time. With the help of nurse practitioner Sharita Chambers and social worker Jim Nattis, the problem of Diana's inability to go to Phelan was confronted, and so arrangements were made to bring Phelan to Diana. Here's a picture of Diana greeting her beloved Phelan for the last time in a horse trailer at the entrance of the hospital. Diana died a few days later. This is a story of innovation, of the ongoing fight of our gynecologic oncology team in the lab, in the operating room, and in chemotherapeutic management, but also of the daily innovations in meaningful patient-centered care, when we must direct our attention to the specific needs of each and every patient. At UHN, we are committed to caring for patients and extending life, but now have a renewed energy and responsibility to offer compassionate and supportive care to those we can't cure. You can't get any higher profile than 60 Minutes on a Sunday evening. Andres Lozano has been working on a tiny area deep in the brain called Area 25, which seems to have a lot to do with severe depression. His groundbreaking work is clearly in the early days, but some of the results of focused deep brain stimulation on carefully selected patients, as seen on 60 Minutes this year, are promising.
The difference is with antidepressants that the 100 billion neurons in your brain get the drug. And here we estimate that we're affecting only a few 100,000 neurons. And so this is a surgical strike.
And here's what a severely depressed patient reported during a deep brain stimulation procedure.
I feel lighter and younger.
Okay.
Lighter.
Lighter.
Lighter, not younger.
Okay. What else?
Just more optimistic.
A story of despair, of courage, of audacity, and surely of hope.